You're listening to Cyber 94 Podcast. If you want to break into cybersecurity with real-life experience, go to cyber94.com.
Chloe, the final numbers from that United Health and Change Healthcare nightmare are out, and it's even worse than we imagined.
Oh, no.
The official report confirms it. Private data on over 100 million people is now in the hands of criminals.
It's hard to even wrap your head around a number that big, Ben. I mean, for context, that's nearly 1 out of every 3 people in the United States.
Wow.
This isn't just a data breach. It's a national-level disaster, and it now sits at the very top of the list as the largest healthcare data breach in history.
And the type of data they lost is what turns this from just a problem into a potential lifetime of pain for people.
Right.
We're not talking about login info for a shopping website.
Not even close. We're talking about the crown jewels of personal identity. I mean, the list of stolen information is terrifying. It can include your social security number, your driver's license, even your passport number. But it gets so much more intimate.
Yeah.
They took health insurance information, group ID numbers, and then, well, the core of your medical life.
Things you only tell your doctor?
Exactly. Your diagnoses, your medications, your test results, your entire treatment history.
Unbelievable.
They also got the billing and financial information, so they know what you paid, what you owe, and they have your banking details.
So, everything.
They basically have a complete, exploitable digital clone of 100 million people.
It's a cyber criminal's absolute jackpot. And what's so maddening, so utterly infuriating about this whole story is how it started.
Yeah.
How did this group, Black Cat, get past the defenses of a multi-billion-dollar healthcare giant?
The answer is almost insultingly simple.
Okay.
The CEO testified that the criminals bought compromised credentials online, a username and a password, and just used them to log into a remote access portal.
Oh, come on.
A portal that didn't have multi-factor authentication.
Unbelievable. It's 2024. That's like leaving the main vault door to a bank unlocked with just a sign on it that says, "Please don't enter."
Exactly.
They didn't have to hack their way in. They opened the door with a key they found lying on the ground.
And once they were inside, they spent 9 days moving silently through the network, mapping everything out, and exfiltrating terabytes of this sensitive data before they finally played their trump card and deployed the ransomware.
9 days.
9 days, completely undetected.
And that explosion crippled the U.S. healthcare system for weeks. Patients couldn't get prescriptions, providers couldn't verify insurance, and hospitals couldn't get paid.
A total mess.
And in the middle of all that chaos, United Health made a desperate choice. They paid the ransom.
A $22 million ransom. And what did that buy them? A short-lived sense of relief.
Right.
Because shortly after, another criminal entity, possibly an affiliate of the first group, came forward and threatened to leak the 4 terabytes of data anyway.
Wow.
It's the ultimate double cross. It just proves that paying the ransom is a gamble, not a solution.
So they paid the fortune, the system was thrown into chaos, and the data of 100 million people is still compromised.
Right?
It's a story with no winners, only victims.
Yeah.
A single basic security oversight created a nightmare for a third of the country.
Now, here's a question we'd like you to think about. As our most private health details become purely digital, who is ultimately responsible for protecting them when a single preventable mistake can expose the lives of millions?